Hello and welcome to the Well Child Show.
Hello and welcome to the Well Child Show, brought to you by Global Child Health and Safety Initiative. Today, as always, you know the show will be beautiful and we have so much to learn. And joining me is a fantastic guest, but I won't reveal until after this break. See you soon. Welcome back. It's still the Well Child Show, brought to you by Global Child Health and Safety Initiative. As you know, Global Health, the show is basically going to provide you with information that has to do with our children and the well-being of our mothers. Today's topic particularly focuses on women, maternal health in particular, and we're going to be addressing the issue of fibroids in women. Many of us know that fibroid is an important aspect of our lives. Why do I say that? I say that because over 80% of Nigerian women often fall into the situation of having fibroids. And research has shown to a very large extent that black women are more susceptible to having fibroids. Joining me today to tackle this all-important issue is someone that I consider very, very dear to my heart. He's not only a medical doctor, he's a philanthropist, and he's someone that is doing something amazing for women across Nigeria and Africa. His name is no other than Dr. Benjamin Olojabotu. Welcome to the show, Dr. Benjamin.
Thank you for having me today, Claire. How are you doing today?
Very well, Dr. Benjamin. And you know what? Today is important for me because as a woman, I feel very much connected to this issue.
I know.
And I also know that too many women, young women that I know, are suffering from fibroid.
Yes, they are.
And it's almost as if their life is coming to an end because this is something that basically causes them to bleed on a daily basis. During the last program that we had, you were our guest, and that day was your birthday.
Yes, it was. Thank you.
One of the, of course, we are still celebrating. And one of the reasons we are bringing you back is because aside from the work that you do in your medical profession, you run a non-profit called the Benjamin Olojabotu Foundation.
That's
Apologies if the name is...
That's okay. It's okay. It's okay.
So what you do in that foundation is a blessing to humanity. I call you our angel in human skin or in human form. But I want us to go and dive deep into this issue because it's extremely important to me. You have mentioned in the last program what fibroid is, but for the benefit of our guests and our viewers that are not that were not a part of last week's show, can you please tell us what fibroid is and what causes fibroid?
Okay, fibroids are non-cancerous growth tumor found in the uterus. So it's found in women. It's not in men, it's just in women. Because every woman has an uterus. Uterus is where the baby stays. So the fibroid grows in that uterus. So it's called a fibroid, you know, myoma, because it's in the uterus. So as I said last time, I said there are types of fibroids. You know, there are, and it is named according to the position of the fibroid in the uterus.
Oh, really?
So you have intramural fibroids, inside the endometrium. You have submucous fibroids inside the muscles of the uterus. You now have pedunculated fibroids. Those are the fibroids hanging on the uterus. You now have subserous fibroids hanging on the skin of the fibroids.
Wow.
So, and these fibroids have now severe symptoms according to their position. For example, if the fibroid is intramural, is inside the womb, you see women bleeding very, very heavily. Instead of using one pad, using 10 pads, using abdominal, using pampers now, because that's where the blood sheds from. So when they are bleeding heavier because the fibroid is just sitting right there inside the endometrium. Now, most of them are now also in the submucous. The pain is excruciating. So imagine if you have a cut on your muscle, so you know how much pain you have. Yes. So because that fibroid is on their muscle, the pain is usually excruciating. So you can't imagine. Now a woman has multiple fibroids in different locations. So think about the pain. Think about the bleeding. So most women have these fibroids in different locations. We call them multiple fibroids, which is what we see on a regular basis. Yeah.
Honestly, sometimes we take these things for men. A lot of men probably don't even have all this information, and they often take these things for granted. Because I have seen women, you know, have this surgery, and it just seems like their life has completely changed. So my next question is this, doctor: does fibroid does it go on its own?
No,
If I leave it,
no. So it doesn't go on its own. So that's a myth that people try to use people to cajole, because when you're very sick, you're looking for help. Anybody tells you anything, you want to follow. Some guys say that they can give you a drug that will shrink the fibroid, or you pass it out through your anus, and those are the fallacies we need to correct today. Now, there's never a connection between your uterus and your alimentary canal. Alimentary canal is where your GIT, your gastrointestinal tract, where food coming through. So it's from your mouth to your esophagus to your stomach to your small intestine to your large intestine to your anus. There's never a connection. So you can't take anything in your mouth that will make your fibroid go from your abdomen into go from your uterus into your GIT. It's wrong. But because people are very, very naive and they're looking for solutions, quick fix and stuff, so people just go there and just come and pay this 40,000 naira, buy this medicine and you shrink it. That's a lie. So as I said, fibroid will not grow. The only time a fibroid will not grow more is when you're not menopausal, which means you're at menopause. If the fibroid is very small, it will stop growing because there's nothing feeding it anymore. There's no bone feeding it anymore. So it will stop, it will rescind, or it will just stay where it is. Some people now have fibroids before they are menopausal. Their tummy is already big. So that fibroid, nothing will shrink it. It will be the same size, but they will not bleed again because they are already menopausal. Some say, okay, I will leave my tummy like that, I don't mind. Some say, no, this tummy is very disfiguring. I can't even go to the bathroom, because sometimes the fibroid is so big and rests on your GIT and your large intestine. So when you even feed, you feel very bloated. You can't go to the bathroom. You have to strain to poo, and that's a lot of problem.
I worry because I've seen cases of where young women come to me and say they want to get surgery, but they are worried that in the event that they have a surgery, because they are still young and unmarried, they may not be able to have children. Can you please demystify this?
Okay, so I tell people one of the leading causes of infertility or subfertility in Africa is fibroids.
Okay. So
one thing is the size and also the positioning. So you see a woman tells you that when I make love to my husband, the sperm just always comes out, because most of the fibroid is just sitting at the endometrium and protein on the cervix, so there's no entrance. So it has blocked the pathway for the sperm to go in and meet any eggs. So if you don't take out the fibroid, you don't even have any opportunity to have a baby. First things first, take out the fibroid. Then there's a space for an egg to grow and a baby to grow. So it's important people understand that. Then it is important when you take out the fibroid, then you can make a baby. People have done so many surgeries for people that somebody just sent me a text today. A woman that we operated in Abia State last year March, she just had a baby boy today.
Wow, that's great.
So she's had it for 10 years, and she was afraid so you had fibroid for 10 years. You've delayed your childbearing for 10 years because you didn't have knowledge that you can take out the fibroid. You're taking a lot of herbal medicines, and it's killing them.
That brings me to an all-important question.
Tell me, please.
In this part of the world, Nigeria, I know our herbal cures are fantastic, but why is it that there is this dominant narrative that herbal medicine is a better alternative than surgery?
So I tell you, very simple. People that are very, very bad, that are not great people, will use your pain to give you psychological defeat. So because people say they are afraid, so they magnify the fear and tell them, if you go and do surgery, you will die. Hey, come to me. I'm something. If I give you this medicine, 2, 3. So I give you a story, very quick story. So one woman came to me from Songwater. She came and said to me that I've taken drugs from 2001 till now. When I go to the man's office, the man will say I should sit down, that he will take out something from my vagina and show me that the fibroid is coming out one by one. Do you know what he does? So he went to buy somebody's fibroid in another hospital.
Oh my goodness.
And kept it in a bucket. So because the man is lying down in a abdomen position, her face is on the other side, he's at the woman perineum. The man doesn't see what he's doing. So after he does that to any man, he says, madam, Anna, it's coming. So after everything, you just say, madam, see what's coming out of you today. So one day the husband now was peeping through the window and said, every day, this time of my wife, it doesn't go down. He now said, okay, this is how they are doing. And every time she goes there, it's 50,000 naira since 2001. Imagine that.
That's
somebody told me clearly, she goes from Lagos to buy an herbal medicine made from the poo of cow in Cotonou for 9 good years.
Oh my goodness.
Because people are going through
and they are complicating the situation on a daily
you are getting
basis.
my point clear. So it's information, love, and compassion that will help people understand that no, there's help for you now. You don't kill yourself with this thing, because this is you are taking, they're cleaning your liver, cleaning your kidneys. So it's important you understand clearly that it's your life, and you must take your life by yourself, not any man, not any baba, not any mama, because our parents are used to this about stuff. So they just tell you, take this, you keep taking it.
And you keep taking and taking and taking.
It doesn't work.
So doctor, one of the questions I would like to ask you is this. There is this perception or this belief, although it's still questionable, that black women or women of Negro women are more susceptible to having fibroids than their white counterpart. Correct. How true is this?
Very correct. So it's not because that we are black. It's not because of our genes. So the researcher said it's very simple. When fibroids started occurring in the early 80s, in the early 18th century, it was the first research that saw it in black Americans.
Okay. And
realized that few people white had it, and as the year goes by, it becomes more effective, more common among black people. So black people. So you won't say it's because you are black. It's not because that's where it's predominantly seen. Some white people have it, but it is more in black people. It's just by research, not because we are black. So I tell people a few things. You know, a lot of black people don't marry as early as white people.
True.
White people, when they're 18, they're like, let me go. Daddy, hello.
They marry their high school sweethearts.
Yes, I'm going to sleep with Charles. Charles leaves. Charles is my high school classmate, you know, that kind of thing. But it's not our culture in Africa, in Nigeria. We want to make all the money. The girls want to be the MD of the banks or the hospitals or everything.
But is that really the case?
No, so that's all. I want a tall, dark, and handsome man, you know. And so if a man is not tall and dark and handsome, they don't marry him. So it's important. I think when we start giving people culture of sustainability, one, and acceptance. So somebody must not be so rich to marry, or you have to understand that the more you delay these things, you give room for the fiber to grow. I told you last week, I said,
yes,
the way the womb is structured, it cannot be a vacuum. Something must grow in the womb, either a baby or a fibroid.
Okay, this conversation can be easily said from the point of view of a man, but I am a woman, and I got married in my 30s.
Yes.
I got married when I clocked 30.
Yes.
And during this period, we have to choose whom we choose to spend the rest of our lives with.
I agree.
The situation for Nigerian women differs because at the end of the day, having the right man and all of that to marry, that's a different conversation for another day.
Prayer is important.
But you see, one question I would like to ask, not everybody is going to get married before within a certain time frame. Not every girl will get married at 18, not every girl will get married at 25.
Correct.
So between when they are waiting for a partner, what can they do to prevent the occurrence of fibroids?
So first things first is, if you have a family history of fibroids, let's say your mother had it or your auntie had it, try and reduce the use of contraceptions.
Okay.
Because contraceptions also increases the estrogen hormones to be to be a lot in the body. That hormone can help you stimulate the fibroid to grow. Yeah. So people that use a lot of Postinol 2, Postinol 1, they need to stop it. So if you have that history, you need to stop it and don't grow fat, because most of the risk factors we see are people that are very obese, they have fibroids a lot. People that have familial history, that means is in their family, have fibroids a lot. People that take a lot of contraceptions. So if you have tendencies, try and reduce these three things, then that might reduce the ability to have a fibroid.
Well, isn't this like a situation whereby a woman doesn't get any opportunity to win it all? Let me use myself as an example.
Go ahead.
I've had 2 children, and I don't intend to have more children.
Okay.
And these children, I had them between when I was 30 and 36.
Yes.
So now I'm done.
Yes.
So what are my chances of preventing fibroids? Is it that, am I safe because I've had 2 children, or do I need to have more children now that I'm approaching 40? And this is a question that is so valid because some women want to have 1 child, some want to have 4, but they have to wait within a certain period.
I agree.
How do we now manage the situation?
2 things is, so if you have a fundamental issue in your family, there's a propensity to have the fibroid. But if it's not there, you've had 2 kids already. Let me give you a scenario. So you had your first kid. So 1 year you didn't, 1 year no menstruation, another 1 year no menstruation. And if you're not on heavy if you don't have all this heavy menstrual flow, the tendency to have a fibroid might not be there.
Okay.
Are you getting me? It depends on the person. It's individualistic. the person. So you can't say it's a general thing.
Okay.
Some will have kids early. They will still have fibroids after because their great auntie somewhere is in their family lineage.
Okay.
So they will still have it. Are you getting my point?
Yeah.
So at that point, they will just maybe expect it and try and salvage it quickly on time, so it doesn't affect them. Affect them a lot, affect their life. So it's important we understand that. So, but in Nigeria, what we have seen is that we need to, if we marry early, not maybe marry, maybe have kids, you may not marry but have kids, have children, and let that womb not be fallow. But that will reduce the capacity. And two things, another thing is that, like what we are doing today, a lot of advocacy and a lot of information. People should seek help on time. People shouldn't die of fibroid anymore. Seek help on time.
That's
you see people carrying a fibroid that looks like a 40 weeks pregnancy. I saw a woman last week that looks like and I asked her, you're just 34. Why did you leave yourself? He said, my mother said that if I do this surgery, one person said I would die.
And that's just a very, I totally agree that advocacy and awareness is extremely very, important. Key, yes. But I want to take you back to the issue of contraceptives again. You mentioned that having using too much of contraceptives is going to be a problem. But again, we also
we don't say it's a lot of problem.
It's not a lot of problem.
It gives you. It is a risk factor.
It's a risk factor.
Yes,
okay.
Of having fibroid.
Okay. So my question is this: a woman ideally wants to use family planning.
Yes.
Are there specific contraceptives that we should be wary of, or just those hormonal kinds?
Hormonal kinds, yes.
Hormonal kinds. Good.
So hormonal kinds. But if you know your body, so it's individual. Every man, every woman can use condoms, diaphragms, very good, because those they have no hormonal impact, because they're just outside. They're just like they're just like organs outside the body. But when you start giving injections, giving drugs that are oral means, those drugs have effect on the uterus, and that can stimulate the uterus to have fibroids. That's what I'm saying. So if you have tendency of having fibroids, you have to choose the contraceptive that you use that will not give you that opportunity to have a fibroid as a woman. Very, very. So that's why family planning is individualistic. You will say because Clay is using this kind of family planning, let that be the guy.
Exactly.
No, that's not it.
Exactly. But it's also very important because these days we encourage young girls to practice safe sex. In practicing safe sex, they should also remember that the onus is not on them to always be the one to, inject themselves with certain things or take Postinol. The men in their life should be also willing to make that extra sacrifice to protect their women.
Let me say that now. Let's say that very clear to everybody. Every man is responsible in keeping the woman safe. Very, very important. So it's your duty. If you love her, you will keep her safe. You wear your condom. You protect her and protect yourself. Very, very important. Please, men, let's protect our women.
I love that, and I know you are a strong women's advocate.
I am.
And
I'm a feminist.
We love you for that. So, doctor, let's talk about lifestyle.
Okay.
What are some of the lifestyle changes that people with fibroid, no matter how complicated or non-complicated, what are some of the things that they should pay attention to, seeing that it's almost like a hopeless situation? You do the right thing, you don't do the right thing, So because if you have a family history of fibroid, if you are obese,
don't say hopeless. People don't So it's not hopeless. There's help for you. So first is obesity. So try not to add weight. Try not to add weight. You exercise, you're eating less, eating late, stuff like that.
Okay.
So you don't eat a lot of meals and stuff like that. It's important you don't eat a lot. Then understand asking your mother's questions, your parents. How did my grandmother die? How did my grandaunt die? Do you have any problem like this? When you start noticing that your menstrual flow is heavier than usual, go see a doctor. It's important. If the fibers are very, very small, really tiny, and they're not disturbing your proper lifestyle, and they're not disturbing your normal activity, there are some injections we can give early enough to prevent the symptoms from really growing. So it's important, you understand, you know yourself. So don't just wait until somebody tells you, what's your tummy? Someone say that I thought I was adding weight too. I don't know, my tummy is getting bigger and looking very, very fresh.
Okay, doctor, there's this other issue that there was a time I was pregnant and I was having pain around my stomach region. And when I went to the hospital, they ran some tests and they said there were cysts.
Yes.
What are cysts? Does it have any relationship with fibroid as well?
No, so they're a lot different. So there's ovarian cyst, which is a cyst means water.
Okay.
Accumulated, that is inflamed in the ovary.
Okay.
So the ovarian, it's called ovarian cyst. The ovary is cystic. Sometimes it can be hemorrhagic. It might mean there's blood in the cyst, blood inside the cyst that is formed in the ovary. Those most times it mimics an appendix, because most times the right of our side is a little upper than our left. So when it's on the right, people think it's appendix sometimes. So you have to be able to decipher, is it appendix or ovarian cyst?
Okay.
When it's appendix, there's vomiting, there's fever, there's pain. So you have right iliac fossa pain.
Okay.
There is vomiting and there is fever. That's what appendix. But for ovarian cyst, the pain is also on the right side, very severe pain, but it's more when you are menstruating.
Okay.
I get it. So that's ovarian cyst, or when you're pregnant, as case may be. So those times, if it's not very, very large, you take medicines and it just dissolves and
on
goes.
its own.
But if it's very big, you have to do a surgery. We call it cystectomy. Take out the
surgery. One question that I need to bring your attention to, doctor, is this: a woman, let's use it. Let's give an illustration. A woman has gone for a surgery, a fibroid surgery. They have taken out large chunks of fibroid. What is the possibility that there can be a regrowth or a recurrence of that?
So there's a possibility.
Yes, really.
There is, yes.
And based on your experience,
because
how often
the womb cannot be fallow.
Wow.
But from my experience, it doesn't really grow, because I'm a very, very detailed surgeon. So I take out every detail.
That brings me to what you do at BOF. So
I take out every detail.
if we were to quantify the number of surgeries you've had in regards to fibroid across Nigeria, the question I would like to ask is, what have been some of the most challenging situations that you have had to treat, and why do you think that happened?
So loads of them. So I'll tell you one in Makodi that had she's had a CS before, and had an appendix before. So there are a lot of additions. When wound heals, it forms addition inside the womb, inside the abdomen. So you have to now begin to separate. So she had this fibroid that was fixed with her large intestine. So we had to first separate large intestine first to give her space to be able to. She pulls once in a week.
Wow,
that's crazy, So we had to take out that one first. First, I taking out the fibroid one after the other. I'm sure you've seen some of our pictures.
Yes, I've seen those images, and it shocks me because you have several large lumps, and I ask myself, how do they find accommodation in this small stomach of ours? So honestly, I have.
It can take anything. What we do in our foundation as a form of work for me, I realize that every small seed can become the biggest kind of stuff. So if you take your time as a surgeon to take out every seed with details and finesse and dexterity, the propensity for them to regrow in quick time is very little. So you give the woman 1-2 years, by the grace of God, they get pregnant, it doesn't grow again. Because when there's a baby there's no ability of the fibroid to grow again. I just advise them, when you get pregnant quickly after surgery, wait another 1 year and they get pregnant again, so that you give yourself, so you don't give because since you have fibroid before, you have a point to have it again. So get pregnant and get married. Just leave have your children, and you cannot stay, and you're going to be okay afterwards. Yes.
Wow. So I quickly took a sample across a number of women that I talked to, and I told them to send in questions. And one of the questions which you may have addressed is, can I get pregnant with multiple fibroids?
So if the fibroids are outside the womb, I've done a surgery for a woman that was pregnant and had 40 weeks out of a fibroid. It was a risky surgery. It's not normal stuff, but I'm not a normal doctor. So I
totally agree. You are totally.
So if it is outside the womb, so this is the womb, and you have a big chunk outside the womb,
of it, the child can still grow.
Can stay there.
And there is no risk that
most times they must be on bed rest from like 8 weeks to when they deliver. So imagine you're on bed for almost 9 months, because any activity on the womb, that size of the fiber, is just like a coconut or a big coconut fighting a small granite, and the granite is trying to fight the coconut up, so it has to be relaxed and fight more until it grows and becomes the size of the fibroid, and it now outgrows the fibroid.
Perfect.
So to say, yes.
I know I have read cases like that where a child and fibroid are actually competing for survival, and at some point the fibroid has to just give way for the child. Another question that I have here is, can you eat eggs if you have fibroid?
Eggs.
Yeah, I don't know.
You can eat anything.
Another one
You
here
can eat
is,
anything.
what are the foods to specifically avoid? Nigeria, we have we have, our foods are mostly carbohydrate.
People say a lot of stuff about food. No, I don't think there's any. Just know that anything that makes you add weight is personal.
Okay.
Don't take things that will make you add a lot of weight, so you don't increase your fat level. When your fat level is increased, you can have issues with fiber. That's the case. So you can eat anything, but know yourself. Don't eat late. Don't eat too much. Don't eat too heavy. So don't add weight. That's what you need to know. Before
I let you go, doctor, I want to ask you something that has to do with the free gift that you are giving to 20 women through the BOF Foundation. Wow. What I want to find out is this: what are the core interest areas you're looking at for this surgery? Are you looking, what kind of cases of fibroid are you looking at? So
we're doing just first surgery cases.
Okay.
Because that's easier to really do. And I've had over like 150 people already asking for the surgery.
For the surgery.
Which already ended the day before yesterday, on 20th today.
Okay.
But we're still open to, because if we see what people are going through, Claire, you're going to cry a lot. Somebody called me today, and very young, pretty lady, and she lost her job because people were calling her that she was pregnant. They're calling her that, and she's always off and off work. Whenever she's menstruating, so imagine you're working for 30 days in an office. We're only there for 10 days because you bleed 20 days stretch. Your boss will not be happy with you. So those kind of stuff touch me a lot. Just want to make her feel better, feel good, and the self-esteem needs to improve. So that's what we're doing. We're just helping 20 women, but obviously we will be oversubscribed. So my need to just do more.
I definitely know that you'll be oversubscribed, because I know how far you choose to help the most vulnerable people. So I want to ask you one final question before I let you go, doctor. How can people support BOF Foundation at this time? Oh,
if you want to support, I'm really happy. Support. You can send us a WhatsApp 08081166492. Or send us an email at benjaminologiab2fdn@gmail.com, or go to our website www.bof.org.ng and just support, make a donation. Let's help more women. Let's make them happy. Let's change our world. Let's change the narrative. Thank you very much, and God bless.
Thank you so much, doctor. It's such a pleasure to have you here, and hopefully we'll bring you back some other time.
I'm always ready.
Thank you so much, and God bless you for the kindness of generosity of your heart. So, my dear Nigerians, my dear Nigerian women, as you know, time flies by, but I want to leave you with this very important message. Life is happening now, irrespective of the challenges you have as a woman, irrespective of the shortcomings that you have or the infirmities that you have. I need you to believe that you'll be fine. But one of the key things you need to remember is to live your life in a manner that is purposeful. Find purpose in your pain, find passion, so that at the end of the day your life will be beautiful and meaningful. And with or without a child, if you are one of the people looking for children, remember the beautiful Ibido Ighodalo. She lived a life of purpose despite the pain in her heart, and today we celebrate her from the magnanimity of her heart. I am dedicating this show to her because she's a woman that I truly admire, and she's a woman that has fought deeply for a lot of women looking for children. And fibroid is an important part of our lives, and we must deal with it, we must talk about it, and we must find ways to support women to become better and loving mothers. So on behalf of the Well Child Show, I would like to say a big thank you for being a part of this show. I know we have not done enough justice to this, so I will find the time to bring Doctor back again so we can look at some of the extenuating issues around fibroid. And then if you have any questions, please send them to our email. I want to call on our beautiful friends. Please support the work that we do on the Well Child Show. As you know, our goal is to support women, support children and their well-being. We are hoping that when you are impacted by something this meaningful, you'll be willing to give more to ensure that our message continues to reach the most vulnerable people. So on Instagram, we are the Well Child Show. Please follow us on Instagram, and then you can also reach us on 080-8330-5051. From myself and my dear friend Kemak, have a lovely day ahead. Bye.